Good day, class. Okay, so I hope you're starting to listen to my lectures regarding sympathomimetics at this moment because this will be included in your final exam. So I have these lectures as the last ones because gusto ko ito yung mga maalala ninyo talaga, because the topic on sympathetic and parasympathetic drugs are very important. These drugs usually are the drugs that we use in clinical practice because these drugs, they have actions on several organs like your cardiovascular, respiratory, and gastrointestinal. Ito usually yung mga may involuntary actions. Those na hindi mo kinokontrol, and then ang may trabaho is the sympathetic and the parasympathetic system. Like, for example, your heart rate, okay? Your heart rate, and then your digestion, and then your breathing. So it involves both systems. Now I'm going to discuss the sympathomimetics today, okay? In this voice recording. If we say sympathomimetics, ibig sabihin, ginagaya niya yung actions ng sympathetic nervous system, okay? It's like your sympathetic nervous system in terms of action. Now, your sympathetics, it covers a variety of organs in the cardio, in the respiratory, in the gastrointestinal, etc. Now, we have to divide the drugs under the sympathomimetics para hindi tayo malito. So, first, you can divide them into two major classifications, the direct and the indirect acting. Okay, so sa tables na binigay ko sa inyo, andun na yung classifications, but you can also see a table sa may review nyo ng Katsung na book. Okay, so under direct acting, what's the difference between direct acting drugs na sympathomimetics and indirect acting drugs? If we say direct acting, these are acting mismo dun sa receptors, dun sa adrenergic receptors ninyo. Alright, which are the alpha, the beta, and the dopamine receptors. Meanwhile, kapag indirect acting, it's not acting on the receptors, but it has something to do with the release of your catecholamines, and then, of course, it has something to do with reuptake also. So, reuptake and release, those are indirect acting drugs, and if it pertains to the action on the receptor, it's already direct acting. Okay? So, pag direct acting, we further subclassify them into alpha, beta, and non-selective. Okay? So, it's very obvious naman. Kapag alpha, drugs under the alpha, of course, mga alpha agonists, nag-a-act lang sila dun sa alpha receptor. If it's beta agonist, syempre, dun lang siya sa beta receptor. And if it's non-selective, it may act on the alpha, on the beta, or even on the dopamine receptor. Okay? So if you can see the table, we have here direct acting, you have the alpha agonist and the beta agonist. Okay? And then, actually, may third pa dapat yan, which is the non-selective. It's different kasi in the Katsung review kasi nilagay niya na rin sa alpha, under alpha agonist, yung non-selective nyo. Okay? But just to make things clear, iba ang selective, iba ang iba ang non-selective, iba ang alpha selective, and iba ang beta selective. Okay? So, under alpha agonist, we can again subdivide them into the alpha 1 selective and the alpha 2 selective. So, we have examples here. For non-selective, we have the epinephrine drug. And for the alpha 1 selective, the phenylephrine. The alpha 2 selective, which is clonidine. Okay? We will tackle one by one later. And for the beta agonist, we have the beta 1 selective, which is dopamine, and the beta 2 selective, albuterol. And another non-selective, but more on the beta receptor, but acting more on the beta receptor, but may also act on the alpha receptor, is the isoproterenol. Okay? And under the indirect acting, we have the releaser, such as the amphetamine, and the reuptake inhibitor, that is cocaine. Okay? So now let's discuss the spectrum of action. Okay? Spectrum, ibig sabihin, ano ba yung coverage niya? Okay? Your adrenoreceptors class, they are classified as the alpha, beta, or dopamine receptors, right? Okay? So, we have I have here in the handout, the different actions kapag nag-a-act siya sa alpha receptor, sa beta receptor, and even in the dopamine receptor. So you have to memorize that. Kasi once na alam mo yung ginagawa ng receptor, okay? So for example, yung drug ninyo is agonist siya sa alpha-1 receptor or alpha-1 selective agonist siya. Okay? When you know that alpha-1 selective, when you know that once may attachment sa alpha-1 receptor, the actions are sa iba't ibang tissues such as the vascular smooth muscle, the pupillary dilator muscle, the bladder trigone or prostatic smooth muscle, and the liver. Okay? Pag alam nyo yung table, pag memorize nyo, you know that when the drug acts on an alpha-1 receptor, okay, meron siyang action na it can increase vascular resistance, okay, because it contracts the vascular muscle, because yun yung action sa alpha-1 receptor. Okay? When you know that a drug is alpha-1 selective, ano magiging action niya sa pupillary dilator muscle? Pag memorize mo yung table, alam mo na yung drug na nag-act sa alpha-1 receptor, kaya niyang i-dilate yung pupils or it causes mydriasis, okay? Because it contracts the pupillary dilator muscle. So, yung table class of the different receptors, that's very important, okay? Dapat meron kayong copy niyan and you have to memorize it by heart, okay? Kasi babalik at babalik kayo. First, ganitong technique, you know the drug. Okay, number 1, of course, kailangan alam mo yung name ng drug mo. And then second, you know the classification of your drug. Is it alpha-1 selective? Is it beta-1 selective? Is it non-selective? Okay? Ngayon, alam mo na yung classification niya. Ay, alpha-1 selective pala ito. For example, phenylephrine is alpha-1 selective. Okay? So, alam mo na ang phenylephrine ay alpha-1 selective na drug. So, ibig sabihin, ang action niya ay sa alpha-1 receptor. And memorize mo yung mga actions, okay, sa alpha-1 receptor. So, ang ginagawa niya ay nagko-contract ng smooth muscle, nagko-contract ng bladder, nag-stimulate ng glycogenolysis sa liver, etc. Okay? Nagko-contract ng pilomotor smooth muscle, nagko-contract ng pupillary dilator muscle. Alright? So that's the importance class. Okay? Okay, next. So, yung epinephrine, okay, it's an example of a non-selective drug. Okay? It may be considered a single prototype agonist with effects at all alpha and beta receptor types. Okay? It was mentioned in your CATSUG that it's a prototype drug that acts on all alpha and beta receptor types. Alternatively, we have phenylephrine, which is an alpha selective agonist, and isoproterenol, which is a beta. Okay? A beta, non-selective siya. However, it acts more on the beta. Okay? On the beta receptor. Now, so that's about the spectrum of action. Spectrum of action meaning it may cover the alpha, the beta receptors, it may cover both, okay, and it may even cover dopamine receptors. Now, for this mode of action, yung sympathomimetic agonist ninyo may directly activate their adrenoreceptors, okay, or they may act indirectly to increase the concentration of endogenous catecholamine transmitter in the synapse. Okay? So, gusto ko lang sabihin, class, again and again, the mode of action, okay, may act on the receptors directly or may act indirectly, okay, through the release of endogenous catecholamines or inhibit the reuptake of these cholamines. Remember, pag nagkakaroon ng reuptake, hindi siya pupunta dun sa postsynaptic vesicle. Hindi siya nag-attach, okay? Binabalik niya dun sa storage, okay? That's the rationale behind reuptake. Okay? So, i-inhibit mo yung reuptake para mas mag-release ka pa ng catecholamine and then thereby, mas marami kang ma-attach dun sa respective receptors. Okay? Now, we go to the chemistry and pharmacokinetics, okay? Just to generalize, okay? The endogenous adrenal receptor agonists such as the epinephrine, norepinephrine, and dopamine are catecholamines and are rapidly metabolized by COMT and MAO, okay? If used as drugs, these adrenal receptor agonists are relatively inactive by the oral route and must be given parenterally. So, kung mapapansin nyo when you go into practice or internship, okay, these drugs are given parenterally because when they are given orally, okay, mabilis silang ma-metabolize. Especially that they are enzymes such as COMT and MAO that are rapidly metabolizing them. Okay? So, when released from nerve endings, they are subsequently taken up by the transporters. We have the NET or DAT. These are transporters into nerve endings and into perisynaptic cells. This uptake may also occur with exogenous norepinephrine, epinephrine, and dopamine given as drugs. Okay? So, again, these agonists also have short duration of action. When given parenterally, they do not enter the CNS in significant amounts. Isoproterenol, which is a synthetic catecholamine, is similar to the endogenous transmitters but is not readily taken up into the nerve endings. Now, your phenylisopropylamines, for example, amphetamines, they are resistant to MAO, remember that, and most of them are not catecholamines and are therefore also resistant to COMT. Okay, that's the special. Okay, that's what's special about amphetamine. Less ang action ng COMT and MAO na enzymes sa kanya. Okay, kaya hindi siya mabilis na name-metabolize ng enzymes na to. Okay, your phenylisopropylamines are orally active, kaya they can be given orally. Okay, they enter the CNS and they have lasting actions. Actually, longer ang action nila kaysa sa catecholamines. Alright, so mechanism of actions. We have the alpha receptor effects, the beta receptor effects, okay, and we have the dopamine receptor effects. Again, you have to study the table. But just to give you a short review, yung sa mga alpha receptor effects, they are mediated, okay? Mediated primarily by the trimeric coupling protein, which is GQ. Once ma-activate itong GQ, okay, yung alpha moiety ng protein activates the enzyme phospholipase C. So, GQ activated, and then na-activate din yung phospholipase C. Pag na-activate na yung phospholipase C, nagkakaroon ng release ng IP3, which is inositol 1,4,5-triphosphate and DAG, or diacylglycerol from the membrane lipids. Okay? Ma'am, bakit pag na-release tong mga to, anong nangyari? Okay? Yung calcium, okay? Yung calcium nagkakaroon ng release from stores in smooth muscle cells. Okay? So, di ba your smooth muscle cells, meron sa sarcoplastic membrane, okay? They contain calcium, okay? Pag na-release ang IP3 mo, from these smooth muscle cells, calcium is being released. Okay? Ang ginagawa naman ng DAG, ina-activate niya yung enzymes. So, IP3 has action on the calcium and DAG has action on the enzymes. Okay? So, anong nangyayari? Nagkakaroon ng activation. Okay? Nagkakaroon ng contraction because remember, your calcium is responsible for contractility. So, mapapansin nyo kapag ang alpha-1 receptor, for example, ay na-activate, usually ang action niya is contraction. Kung makikita nyo dun sa table, okay, alpha-1 contracts the smooth muscle, vascular smooth muscle, contracts the pupillary dilator muscle, contracts the pilomotor smooth muscle, and then contracts the bladder trigone and the liver as well because of the action of calcium. Okay? Direct gating of calcium channels may also play a role in increasing intracellular calcium concentration. Okay? So, nagkakaroon ng higher concentration din ng calcium dun sa cell. Okay? Ang nangyari, a specific part of the cell, okay, which is the sarcoplasmic reticulum, nare-release from there yung calcium. So, lumalabas yung calcium, na-spread siya within the cell, within the smooth muscle cell, and thereby now causing contraction. Alright? So, ganun lang siya kadali. You just have to memorize by heart the cascade. Okay? Ang drugs ninyo, when they are being attached to the alpha-1 receptor, they cause the activation of GQ, thereby activating phospholipase C. When phospholipase C is activated, it releases IP3 and DAG. IP3 causes increased release of calcium, thereby releasing the intracellular concentration of calcium. At kapag increase yung concentration ng calcium within the cell, it causes contractility. So, ganun lang siya kadali. That's why the action of alpha-1 and even alpha-2, actually, more ang contraction in the alpha-1 receptors. Okay? But also alpha-2 can cause contraction din naman. So, yun ang ginagawa ng alpha receptors. Okay? I hope you understand the cascade. Next, pag beta receptors naman, all beta receptors, we have beta-1, beta-2, and beta-3. Ang ginagawa naman nila, they stimulate adenylyl cyclase via the coupling protein which is GS. Kung GQ sa alpha, okay, in the beta receptor, it's GS. Okay? So, na-stimulate na yung adenylyl cyclase. Once it's stimulated, it increases, okay, cyclin adenosine monophosphate or CAMP. Okay? And then, kapag meron kayong CAMP, okay, your CAMP now has an action on the different organs, such as the heart, the kidney, the airways. And then, you just have to read kung doon sa table kung asan bang beta-1, beta-2, and beta-3. Okay? Just to give you a simple trick to memorize. Diba 1, your heart, you have only one heart. So beta-1, there are beta receptors on the heart, beta-1 receptors on the heart. And meanwhile, yung beta-2 receptors naman, diba you have 2 lungs? So beta-2 receptors are found in your lungs. Okay? So, anong isipin mong drug na ibibigay in a patient with a cardiac condition at kailangan mong i-increase yung heart rate niya? Okay? Or mag-stimulate ng rate at saka force para dun sa pumping ng heart niya. Of course, you will give a beta-1. Okay? A beta-1 selective. Beta-1 selective sympathomimetic. Okay. Next, you have a patient with respiratory condition. Meron siyang asthma. So, gusto mong i-bronchodilate. Okay? Kasi ang problem sa asthma is bronchoconstriction and then naninikip yung airways nila. So, you want the bronchioles to be dilated. Okay? Anong target receptors mo for that? Ano ba ang common na receptors sa inyong lungs? You have the beta-2. So, naturally, ang bibigay mo na drug ay beta-2 selective. And an example is albuterol. Okay? Albuterol, we use this in patients with asthma. Okay? So, very, diba? Very easy lang once you try to understand it slowly, okay? And you understand it by heart. So, yung sa dopamine receptors naman, yung dopamine or D1 receptors, they also activate adenylyl cyclase parang sa beta receptor then via the GS, they increase CAMP in neurons and vascular smooth muscle. So, more actions on the neurons and vascular smooth muscle. Your D2 receptors are more important in the brain, but probably may significant role din sa presynaptic receptors on peripheral nerves. Okay? These receptors reduce the synthesis of CAMP via G1. So, reduce ang synthesis ng CAMP if the coupling protein being activated is G1, but it increases, okay, the synthesis of CAMP kapag ang na-activate na G-coupled protein ay yung GS. Okay? So, next. We go now to the drugs one by one. So, we start with epinephrine. Okay? You have also to read, I advise you to read the different organ systems. Specifically, meron sa Katzung review book ninyo na nag-mention siya ng iba't ibang systems and yung action ng mga sympathomimetics nyo sa different systems. Like for example, meron din siyang action sa CNS, in the heart, in the respiratory, okay, in the smooth muscles, gastrointestinal, etc. Okay? Okay, so again, we review Sabi natin, yung sympathomimetic drugs, they act either indirectly or directly, okay, to activate postjunctional and prejunctional adrenoreceptors to mimic the effects of endogenous catecholamines such as norepinephrine and epinephrine. Inside the body, we have natural, ibig sabihin, endogenous substances such as norepinephrine and epinephrine, okay? And our drugs mimic the effects of these endogenous catecholamines once administered. So you should be clear with that. Okay? So, yung actions nila, they generally are predicted from the type and location of the receptors. Type, ibig sabihin alpha ba to or beta ba to? And then, pwedeng dopamine receptor din. And then, location of the receptors. Are these receptors located more in the heart or in the lungs? Just as what I've mentioned a while ago. Okay? So, to clarify lang again, class, yung mga indirect natin na acting agents, they act within nerve endings to increase the release of stored catecholamines. Okay, that was also mentioned in the handout given to you. They either block the reuptake of catecholamines that have been released from the nerve endings, or they increase the level of release of the stored catecholamines. Second, diba? First, reuptake inhibitors, second, releasers, and then meron pang third, pwedeng through enzymatic action to prevent biotransformation of your catecholamines. Yung mga gamit, yung mga COMT, at saka yung mga MAO, okay? To prevent yung breakdown ng catecholamines ninyo. So, para to prevent the breakdown of these catecholamines, we inhibit the enzymes. But these are less used, okay? This classification of drugs are less used, okay? Mas ginagamit yung mga, syempre, yung mga direct acting. They are the most preferable. And then we can also use the reuptakes inhibitors and the releasers, but not so much of the drugs acting on the enzymes. More on specific yun for the central nervous system. Okay, yung mga MAOI, yung mga COMT inhibitors. Alright? So yung pharmacologic effects, I've mentioned in different organs such as the cardiovascular, and then pwede rin sa respiratory, even in the metabolic and endocrine system. Okay, pwede rin sa genitourinary and also in the eye. Okay, so I told you, yung sa mga adrenoreceptor agonists or sympathomimetics, okay, they have an action on the different systems, especially sa heart, okay, especially sa eye, okay, sa genitourinary and metabolic and endocrine, okay. Ang gastrointestinal more kasi on the parasympathetic, mas active siya on the parasympathetic side. Right? So you just have to review sa actions nila sa different systems. You have to review that. Meron yan sa Katzung book. And then meron din dun sa handout na binigay ko sa inyo. Okay? So let's go first to epinephrine. So if you can see the table I sent you even before pa yung summary ng lahat ng drugs, we have their epinephrine, alright? So, pag sinabing epinephrine, it's a non-selective. Ibig sabihin, it has actions on both the alpha and the beta. If it's in the alpha, it's more active, okay? It acts on the alpha-1 receptor and causes vasoconstriction, narrowing of the blood vessel, and it increases blood pressure. Okay? From the name itself, epinephrine yung gamot, meron tayong endogenous catecholamine ni epinephrine inside the body. Okay? Now, for the beta-1, it increases naman heart rate, conduction, and contractility. Okay? So, it triggers rate and force. Okay? It increases heart rate, it increases the force or contractility or pumping of the heart. It has also action in the beta-2. Okay? It causes bronchodilation. That's why, again, it's not a non-selective because it acts on the alpha and the beta. Okay, ano ang mga main uses niya? We use epinephrine during cardiac arrest. Okay, so once a patient goes into arrest, okay, biglang nawala yung heartbeat, we always explain to our patients as physicians on my side, no? We explain to the patients na para bumalik yung tibok ng pasyente, okay, magbibigay tayo ng isang malakas na gamot, okay, na maaaring makapagpabalik po ng tibok ng puso niya. And that is epinephrine, okay? The epinephrine is a potent vasoconstrictor, okay? Kakonstrict niya yung blood vessels to increase the pressure, okay? Para mas stimulate, okay? Yung activity ng heart. Alright? So what else? Aside from cardiac arrest, it is also used in anaphylaxis. Actually, it's the drug of choice, especially in patients na nag-undergo ng hypersensitivity. Okay? By the way, class, hypersensitivity is different from anaphylaxis. It's a severe form of hypersensitivity ang anaphylaxis nyo. Usually, lalo na pag in patients with severe allergies, okay, na hindi controlled, okay, patients go into wheezing, difficulty of breathing, temperature changes, even hypotension, extreme BP changes, okay, that are uncontrolled. So, ito yung mga patients na nag-anaphylaxis, and we immediately give epinephrine as the drug of choice for them. We also use epinephrine sa patients with asthma. Why? Because of the bronchodilation. But it's not the drug of choice, okay? In patients with asthma na kailangan mo ng bronchodilator, more on the beta-2 agonists, okay? But epinephrine also has an effect on patients with asthma. Also in patients with COPD or chronic obstructive pulmonary disease, and in patients with hemostasis, okay? Yung increased bleeding or mga nag-epistaxis, usually yung ginagawa namin, nag-epinephrine pack kami dyan, okay? When bleeding is not controlled or nose bleeding is not controlled, tapos persistent epistaxis yung pasyente, we usually, sa mga gasa, naglalagay kami ng epinephrine. We call that epinephrine packing, okay? Para sa to reduce or even stop the bleeding, okay? Epinephrine kasi is a great vasoconstrictor, okay? So, nipis niya or pinapanarrow na yung blood vessels. Side effects, since it increases heart rate, it increases BP, of course, it may cause hypertension, tachycardia, diba? Kasi it increases heart rate, ischemia, because when you narrow your blood vessels, less ang blood flow, so less ang oxygen na nasusupply. When there is decreased blood flow, there is decreased oxygen supply, so nagkakaroon ng ischemia, okay? And then also hyperglycemia. Okay, so special notes lang, epinephrine is inactive orally. Okay, it does not enter the CNS significantly. It has a very short duration of action. Okay, it can cross the placenta and may cause fetal anoxia. So please be cautious in giving this to pregnant patients. What else? Again, just remember class, for notes in epinephrine, it activates the alpha, the beta-1, and the beta-2 adrenal receptors, okay? Your epinephrine, kaya siya nag-i-increase ng BP kasi it increases the systolic pressure, okay? It has a positive inotropic and chronotropic effects of the heart. If it's inotropic, ibig sabihin, inotropic, it increases contractility. Pag sinabi natin chronotropic, it increases heart rate, okay? Mas lalo nyo siyang mapag-aaralan when you go into cardiovascular system sa pharmacology 2. Okay, what else? It decreases total peripheral resistance and decreased diastolic pressure due to vasodilation in the vascular bed of skeletal muscle. Okay, so meron siyang beta-2 receptor activation. Because ang beta-2 receptor naman, the action on the heart, okay, is decreased diastolic pressure due to vasodilation and decreased total peripheral resistance. Okay, you just have to remember that for now or even memorize it if needed kasi mas matatakal na yung mga terms, yung mga total peripheral resistance, diastolic and systolic pressure once you're already in cardiovascular system for pharmacology 2. Okay? What else? At high doses, your epinephrine causes vasoconstriction in the vascular bed of skeletal muscle. So remember this class, kapag alpha receptor activation, it's vasoconstriction. But if it's beta, okay, if the drug is or was attached to the beta receptor, if it's a beta receptor activation, the effect is vasodilation. But if it's alpha receptor activation, it's vasoconstriction. Please remember that. What else? Epinephrine, it increases coronary blood flow as a result of increased cardiac workload. It may precipitate angina in patients with coronary insufficiency. Just as what I said, it may decrease oxygen supply, thereby causing ischemia. Pag may ischemia, it's synonymous with angina. Okay? Now, what else? For the eye naman, it has the capability of increasing the drainage of aqueous humor through alpha receptor activation. Remember, pag alpha receptor, ang effect niya is contraction. Okay? So, pag nagko-contract, ni-increase niya yung pag-drain. Okay? Kasi active siya, di ba? And it's contraction or constriction, parang kino-compress niya. So, nangyayari, nag-i-increase yung pag-drain mo ng aqueous humor. Okay? Ano ba ang importance na pag-increase ng drainage or pagbawas ng aqueous humor? Because when you have a lot of it, okay, nagkakos yun ng increased pressure. Okay? So, patients eventually have open-angle glaucoma because that's the problem in glaucoma. You have too much pressure on the eyes because of accumulation of too much fluid, yung aqueous humor mo. So, you want to drain that, okay? So, ang magandang ibigay also in these patients for increased drainage of the aqueous humor by alpha receptor activation is epinephrine, okay? So, what else? It dilates the pupil, okay? It causes mydriasis by contraction of the radial muscle of the eye, okay, through alpha receptor activation. And of course, epinephrine, it relaxes the bronchial smooth muscle. It causes bronchodilation via the beta-2 receptor activation. Alright. So next, yung norepinephrine. Your norepinephrine, rarely used yan therapeutically. Okay? Ang action niya naman, more on the beta-1. It has action on the alpha receptors. Okay? It activates also beta-1 and beta-2, but compared, pero pag ipagkukumpara nyo ang beta-1 and beta-2, it has more action on the beta-1. Okay? So, if I'm going to ask you now, saan mas may effect ang norepinephrine nyo? Is it in the heart or in the lungs? Ano bang receptor sa heart? The B1 receptors, right? And in the lungs, the B2 receptors. So, you're going to answer me na mas may effect ang norepinephrine sa heart. Okay? Rarely used siya because yun nga, less ang coverage niya sa alpha and beta receptors, especially sa beta receptors kung saan B1 lang siya. Okay? Very little lang sa beta 2 and more on the beta 1. Okay? So we usually give norepinephrine. A famous brand for that is Levophed. If we want to increase the BP of the patients when our patients are in hypotension, okay? So we usually give them norepinephrine. Okay, because it can increase BP. It acts on the alpha-1 to cause vasoconstriction. It increases the BP. For beta-1, it increases the heart rate, conduction, and contractility. And for the beta-2, it may cause bronchodilation but little activity compared to epinephrine. Kasi nga, little lang ang beta-2 ng norepinephrine. Okay. We use this in patients with neurogenic shock or cardiogenic shock as last result. Okay? In patients with shock kasi, nagdi-decrease talaga yung BP nila. They undergo hypotension, okay? Severe hypotension. So what we give to these patients to increase their BP is norepinephrine, right? So side effect, maybe extreme vasospasm, tissue necrosis, excessive BP increase, lalo na pag hindi na-regulate yung binigay na norepinephrine na drip sa patient, kaya kailangan siyang babantayan. So in patients na binibigyan namin ng norepinephrine drip, okay, we monitor their BP and by the time na mag-increase na yung BP nila, i-decrease namin yung regulation ng norepinephrine drip. Okay? So, usually in increments yan. For example, we order in our charts kapag tumaas na ng ganitong BP yung patient or pag ma-reach na natin yung target BP for the patient, okay, we can now start titrating down or tapering down, okay, the regulation of our norepinephrine drip para hindi siya mag-undergo into excessive BP increase tapos lead naman into extreme hypertension or hypertensive crisis. Okay? So, norepinephrine has side effects also like arrhythmias, infarction, and reflex bradycardia. Okay? So, notes, we have compensatory vagal reflexes tend to overcome the direct positive chronotropic effects. Okay? So, in the body kasi class, usually nagkakaroon din ng compensation. Okay? We have systems in the body like the RAAS, okay, the humoral mechanism. Usually, pag nakaka-detect sila ng decrease or increase in BP, sila muna yung gumagawa ng paraan or the body does something to compensate for that increase in BP or decrease in BP. Okay? So, yan. Minsan, na-overcome, okay, ng compensatory vagal reflexes in the body, yung mismong action ng drug natin. Alright? So, remember, in norepinephrine, it has also more alpha actions than beta actions. So, kung i-rate niya siya from increasing to decreasing order, the highest will be on the alpha receptor, next yung beta 1, and syempre last lang, or konting effect lang dun sa beta 2. Same as epinephrine, it is inactive per ORM, it does not enter CNS, and also it has a shorter duration of action. Next, dopamine. So, dopamine, same lang din, almost the same doon sa inyong norepinephrine and epinephrine. May action siya sa alpha 1 at sa beta 1. But what's peculiar about this drug is, of course, from the name itself, meron siyang action sa dopamine receptor, specifically at the D1. So, it causes vasodilation in splanchnic and renal blood vessels. So, you have to highlight splanchnic and renal blood vessels. It may be used in patients with cardiogenic shock or heart failure. And the side effects, CVS disturbance or cardiovascular system disturbance, and arrhythmias. It is inactive per ORM. It does not enter CNS. Short duration of action and very effective in renal failure associated with shock. So, if a patient, has a renal disease, and also probably a patient with a chronic kidney disease secondary to hypertension or hypertensive nephrosclerosis, and then biglang baba yung BP ng pasyente, okay? Isipin mong unang drug is dopamine, okay? Ano kayang drug na pwede kong ibigay sa patient or ang pwedeng i-drip ni doc dun sa patient na mag-i-increase ng BP niya? At the same time, meron din siyang effect sa renal blood vessels. Of course, may renal disease yung patient mo, plus may hypertension pa siya. May hypotension pa siya. Okay? Probably because of the compensatory reflexes din. Okay? For example, patient mo may CKD, tapos secondary to hypertensive crisis, nag-try mag-compensate yung body, so biglang nag-hypotension. So, what drip will you give to increase the BP on a stable level, okay? At the same time, address also the kidney disease of the patient, okay? May action din sa renal blood vessels. Yeah, so you can give dopamine as your drip, okay? Next, for isoproterenol, it is a non-selective beta-adrenergic receptor, okay? Activator. So, sabi niya dito, non-selective beta-adrenergic receptor. Ibig sabihin, selective siya sa beta, pero non-selective beta. Ibig sabihin, it acts both on the beta 1 and the beta 2. For beta 1, it increases the heart rate, conduction, and contractility. And for beta 2, it can cause bronchodilation. But it is mainly used for asthma. So actually, more on the B2 naman to. However, it has effects on beta 1 also. But mainly used dun sa action niya sa B2, it is mainly used for asthma. Side effects, CVS disturbance and arrhythmias. And it can... It is not readily taken up actually into nerve endings, and it is a synthetic catecholamine. Okay? So, class, again, importante itong mga drugs na to, lalo na yung norepinephrine, epinephrine, and dopamine. Especially if the patient is on a life-threatening state, okay? Lalo na yung mga bagsak talaga yung BP. So, these drugs are very effective. Alright? Yung sa dopamine naman, okay? Yung dopamine, it activates the peripheral beta-1 adrenoreceptors to increase heart rate and contractility, right? Okay? And then also, may effect din siya sa D1 receptors. So, lagi kong sinasabi yan because our D1 receptors, they are found in the renal, in the coronary, in the splanchnic vessels. Okay? Nire-reduce na yung arterial pressure. Okay? Yung arterial resistance rather. And increase na yung blood flow para increase din yung blood pressure. Okay? What else? At low doses, remember this, yung dopamine ninyo, it has a positive inotropic effect and it increases systolic blood pressure with little effect on the diastolic pressure. Pag high doses naman, dopamine activates the alpha receptors and causes vasoconstriction with a reflex decrease in heart rate. Okay, so magkaiba sila. Remember, pag low doses, more on the inotropic effect niya sa beta 1. Okay, positive inotropic effect, ibig sabihin, nag-i-increase siya ng contractility. Okay, pag-increase ng contractility, increase ang systolic pressure. Meanwhile, pag high doses naman, okay, sa alpha naman siya. So, low doses sa beta, sa high doses sa alpha naman. And pag nag-act siya sa alpha, nagkakos siya ng vasoconstriction, so narrowing ng blood vessel. Okay? Pag nagkaroon ng narrowing ng blood vessel or vasoconstriction, nagkakaroon naman ng reflex decrease in heart rate. Okay? So, ibig sabihin, pag low dose, more on the contractility, increased contractility, and for high doses, it may cause a decrease in heart rate. For low doses, acts on the beta, and for high doses, acts on the alpha. Now, yung dopamine, meron siyang corresponding na mcg per kilogram per minute. It's low dose if it's 1 to 5 mcg per kilogram per minute. Medium dose, pag 5 to 15 mcg per kilogram per minute. And high dose if it's more than 15 mcg per kilogram per minute. So, these are your guidelines or your basis, dose basis, okay, para alam mo kung anong ibibigay mo na dose. Like for example, if you want vasoconstriction to happen, okay, of course, and also increase BP, of course, bibigay ka ng high dose. Okay, but be wary kasi pwede siyang mag-cause ng reflex na decrease in heart rate. Paano pag yung pasyente mo mababa na pala or nagba-bradycardia, mababa na dati yung heart rate niya. So, hindi ka magbibigay ng high dose or you must be cautious in giving high dose dopamine to these patients. So, please read on the table yung low actions kapag low dose ang binigay mo, actions kapag medium dose, and yung actions kapag high dose. Alright? Okay, so punta naman tayo sa mga selective, the alpha selective agonist and the beta selective agonist. So we first go to the alpha selective drugs. So meron sa alpha 1 and then meron din sa alpha 2. For the alpha 1 selective for the alpha 1 selective agonist, we have phenylephrine. Similar drugs are pseudoephedrine, oxymetazoline, tetrahydrozoline, midodrine, nafazoline, and silometazoline. Okay? Does it ring a bell kapag narinig yung phenylephrine? Your phenylephrine is found in your Neozep, in your Bioflu. Okay? Yun sa mga drugs niya for colds. Alright? So, mainly, ang phenylephrine, it's used as a nasal decongestant. Okay? It has actions mainly on the alpha 1. It causes vasoconstriction and it may cause increased BP also. Ma'am, anong nangyari? Bakit siya nasal decongestant? Tapos anong connect niya sa vasoconstriction? Okay? So usually kasi class, in patients with nasal congestion, okay, they have dilated blood vessels kaya stuffy yung nose nyo because yung mga blood vessels ninyo are dilated and you need a drug to shrink these blood vessels, okay? To prevent nasal congestion or to reduce nasal congestion, okay? Usually kasi kapag dilated ang blood vessel, syempre nagkakaroon ng sinus pressure, okay? So nagkakaroon ng nasal congestion. So, what do we give? Okay? Because we have dilated blood vessels in patients with nasal congestion, of course, magbibigay ka ng magko-constrict dun sa blood vessel. So, you give a drug that will cause vasoconstriction. Okay? And that is your alpha 1 selective agonist because your alpha 1 receptors are found in these areas. Alright? So, in patients with nasal congestion, we give them phenylephrine. What are the other uses? Phenylephrine is also a mydriatic. Okay? If you want to increase the blood pressure, we have a drug-induced hypotension. Okay? occasion or minsan sa isang pasyente na biglang nag-hypotension, you can give a safe drug which is phenylephrine because it increases BP. And of course, in patients with hypotension and in patients with spinal shock, okay, phenylephrine may be a choice. Now, your side effects, pwede ka magkaroon ng rebound nasal congestion or what we call the rhinitis medicamentosa. Okay, ibig sabihin, kaya in some patients, sabi nila hindi na effective yung Neozep. Okay? Kasi, or kahit yung Neozep naman, parang andun pa rin naman yung sipon. So, this is the reason why. Baka tapos hatching na lang sila ng hatching lagi. Kasi baka meron na siyang tolerance, okay? Or naging less effective na yung drug. So, what happens in these patients, imbes na gumaling din sila, lagi silang nagtitake ng Neozep, kahit konting sipon lang, it may lead to rhinitis medicamentosa. Okay? What else? It may cause supine hypertension, stroke, MI, piloerection, and urinary retention. Okay? So, you must be careful also in giving your phenylephrine. Kasi, di ba, bigay lang tayo ng bigay. Kasi OTC drug naman siya. Hindi naman kailangan ng reseta. As pharmacists, it's your responsibility also that before you dispense these drugs, you must ask your patients if they have hypertension or they are undergoing, okay, hypertensive therapy. Ibig sabihin, anti-hypertensive therapy. Ibig sabihin, ongoing silang ongoing sila or meron silang mga uncontrolled na BPs. Okay? Lalo na pag sobrang taas. Kasi pag nag-take pa sila ng gamot nito, may chance na mas lalong tataas yung BP nila. Okay? Pag tumaas yung BP, okay, ng sobra-sobra, pwedeng magkaroon ng stroke. Okay? Biglang tataas yung pressure sa brain vessels din. Okay? So, it may cause stroke. Biglang puputok yung blood vessels because of too much pressure. So, be careful also. Kahit OTC sila, dapat hindi kayo bigay lang ng bigay. You must also investigate. You must also counsel. Okay? In patients na bumibili, you ask them, may BP elevations po ba na history or dati na po bang may hypertension? Okay, importante po na bago po mag-take nitong ng drug ay normal po yung BP po ninyo or nakokontrol po yung BP ninyo. Okay? So, please remember that. If you have families or relatives na laging nagtitake or mahiling mag-take ng mga drugs for nasal congestion containing phenylephrine, okay, you check on their blood pressure also. Okay? So, avoid pseudoephedrine in first term may cause gastroschisis. Okay, so you do not give this to patients na pregnant kasi pwedeng mag-cause ng teratogenic effect. Okay, what else? So for your phenylephrine, okay, these drugs kasi they are less potent, okay, but they have longer duration of action kasi they are not being metabolized by the enzyme COMT. So etong class of drugs na ito, they are not being metabolized by COMT, thus they have longer duration of action. Okay, ano pa? For your oxymetazoline, please remember, just take note, okay, na these drugs have selective action mainly sa alpha receptors talaga sila. Okay, at high doses, these drugs may cause clonidine-like effects because they have also action. Pag clonidine kasi may action siya sa CNS, hindi lang sa peripherals. Okay, hindi lang sa sympathetic system. So, meron din siyang action mainly on the central nervous system. So, pag high doses, pwedeng maging clonidine-like yung silometazoline or yung oxymetazoline. Okay? Now, we go to clonidine, which is an alpha-2 agonist. Your clonidine, methyl dopa, and apraclonidine, they are all alpha-2 agonists. Class, please remember this one. Okay, never ever forget that your clonidine and methyl dopa, they are acting on the alpha-2. That's a board exam usual question. Okay, your clonidine and your methyl dopa, they are alpha-2 agonists because if they might ask you or they might put in the choices letter A alpha-1, letter B alpha-2. Okay, and worse, kapag nilagay pa nila doon alpha-1 agonist, alpha-1 antagonist kasi maraming nalilito. So your clonidine and methyl dopa, they are agonists and specifically at the alpha-2 receptor. Okay, let's go to clonidine. Your clonidine, it decreases central sympathetic outflow. Okay, So remember, your clonidine is a central nervous acting system drug. Okay? So, dinidecrease niya mismo dun sa central, dun sa nagko-control ng sympathetic outflow. Okay? Dinidecrease niya mismo dun sa central area. Okay? Because a certain part, okay, sa higher brain, okay, a certain part or sa supraspinal area, okay, a certain part in your central nervous system is also taking part in the sympathetic outflow. So, dun nag-act mismo yung clonidine. So, when you are asked, ano ba yung mga centrally acting drugs natin? So, your clonidine and methyl dopa, they are centrally acting drugs. In the CNS area, okay, merong in charge doon sa sympathetic outflow. And ang drugs na nag-act doon are your clonidine and methyl dopa. Okay? So, first sa clonidine muna tayo. It is used for hypertension. It may also be used for cancer pain and opioid withdrawal. Side effects, sedation, rebound hypertension, and dry mouth. Okay, class, remember this. Usually in patients with hypertensive crisis or mga nag-hypertensive urgency or emergency, in patients with hypertensive urgency, usually mga more than 180 over 110 na BP. Okay, that's already hypertensive urgency. Okay, pag walang target organ damage or walang other organ symptoms evident, we call it as hypertensive urgency. Okay, especially pag yung BP niya ay more than 180 over 110 na. We give immediately clonidine na sublingual. Okay, it's available as 75 mcg and 150 mcg. Pero mas common ngayon sa market ang 150 mcg. So, inhati muna namin siya and then binibigay namin under the tongue. Okay, para mas mabilis yung effect because under the tongue, you have rich blood vessels doon. Okay, so mas mabilis ang absorption. Now, your clonidine, okay, it's a very useful drug for hypertensive emergencies, urgencies or emergencies, and even hypertensive crisis, right? So, guys, it's a strong drug that decreases BP in a short period of time. However, kaya natin siya hindi regularly na binibigay as maintenance because it may cause rebound hypertension, especially na it's centrally acting. Okay? So, remember the side effects, rebound hypertension, that's a common question. And aside from that, yung dry mouth then and sedation. So, usually, mga patients na ginagawa nilang bigla ang maintenance kahit hindi naman kailangan, biglang tulog ng tulog, okay? Imbes na bumaba yung BP, masyadong mataas yung BP. So, those are side effects already. The 3 common side effects, rebound hypertension, dry mouth, and sedation. So, taper use. What happens if there's rebound hypertension? Of course, we taper the use. Okay? Prior to discontinuance of the drug. Kasi baka magulat naman yung katawan. Alright? So, when we discontinue clonidine, when we want it to be discontinued, we taper down. Okay? The way on how to control the side effect is to taper the use first before discontinuance. Okay? We have phentolamine, okay, as an antidote if we have a patient with rebound hypertension from clonidine use. So phentolamine is a good reversal agent. Next, when taken per ORM, there is initial increase in BP, then will go down once the drug enters the CNS. Okay? So, that's the pathophysiology. Now, for methyl dopa, we have similar drugs, guanfacine, guanabens, dexmedetomidine, and tizanidine. Okay? But the most famous is methyl dopa. It acts on the alpha-2 receptor. It decreases the central sympathetic outflow. We use this usually also in hypertensive emergencies or urgencies, but mas common siya in patients with under labor, okay, in patients with preeclampsia. That's a condition na mataas na BP in pregnant patients, gestational hypertension. Okay? Pag dexmedeto naman, it can be used as a sedative, and tizanidine, it can be used as a muscle relaxant. Its side effect, it may cause sedation, hemolytic anemia. Positive siya sa Coombs test. It's a test to check for hemolysis or to investigate if patient has hemolytic anemia. Usually, kapag may methyl dopa side effects na positive ang Coombs test, ibig sabihin the patient has hemolytic anemia or is undergoing hemolysis. So remember that class, methyl-dopa hemolytic anemia. For your apraclonidine, brimonidine is a similar drug. It decreases secretion of aqueous humor. So this is more used for patients with glaucoma. Side effects: blurring of vision, dry mouth, hyperemia, pruritus, eye discomfort. Alright? So remember, ang dry mouth, it's a side effect of your sympathetic drugs na sympathomimetic. Usually, class, pag makikita kayo ng mga side effects na dryness, okay? Usually, these are side effects of your sympathomimetic drugs. For example, yung dry mouth sa clonidine, and yun yung sa Apra, also dry mouth. Alright? So, okay, parang hindi lang kayo ulit malito. Di ba I told you a while ago na sa clonidine and methyl-dopa, they are centrally acting drugs. Okay? Nagde-decrease sila na, they increase sympathetic outflow. They affect sympathetic outflow by acting on the central nervous system. And kanina ko pa sinasabi na a certain area on the central nervous system, okay, has actions on the sympathetic outflow. If you're interested or if you're wondering kung anong area yon in the brain, it's in the vasomotor center of the medulla. Okay? So, yung antihypertensive agents nyo, directly or indirectly activate prejunctional and possibly postjunctional alpha-2 receptors in the vasomotor center of the medulla to reduce sympathetic tone. Okay? So, ang clonidine, it's an alpha-2 agonist, but the action is decreased sympathetic tone, okay, or reduced sympathetic tone, because it's the action of the vasomotor area of the medulla in the brain, okay, reduce sympathetic tone. Kaya imbes na ang action sana is increase BP, ang nangyayari is you would decrease the BP. Alright? So, sana hindi kayo malito, class. Okay? Di ba nagbanggit ako ng mga alpha-1 kanina? Remember your alpha-1 kanina, like, for example, let's state an example, yung mga norepinephrine, epinephrine, these are alpha-1 receptors, di ba? Acting on the alpha-1 receptors, they cause vasoconstriction and increase BP. However, it's different sa alpha-2. Pag alpha-2 naman, it will decrease the BP. Okay? Because yung action niya is sa central nervous system, sa vasomotor center ng medulla. Okay? And ang gawain or action sa vasomotor center in the medulla is reduce sympathetic tone. So, nire-reduce niya yung heart rate, contractility, conduction, thereby decreasing BP. Okay? So, pag alpha-1, increase BP. If it's alpha-2, decrease BP. That's why I use your clonidine and methyl-dopa, the alpha-2 receptors, the centrally acting drugs, you use them for patients with hypertension to decrease the BP. Okay? So, I hope it's clear. Next. So, these drugs, they reduce blood pressure. Yung both clonidine and methyl-dopa, they reduce the blood pressure with the decrease in total peripheral resistance and minimal long-term effects on the cardiac output and heart rate. So, methyl-dopa, it's a prodrug, metabolized to the active agent. The active agent is alpha-methylnorepinephrine and alpha-methyldopamine in nerve endings. It lowers blood pressure by reducing the peripheral vascular resistance. At higher non-therapeutic doses, it activates peripheral alpha receptors to cause vasoconstriction. So remember, ang methyl-dopa naman, if it's in high doses, okay, too high, na non-therapeutic dose or in patients na nag-overdose, for example, higher non-therapeutic doses, it activates the peripheral alpha receptors to cause vasoconstriction. Okay. Next, we go to the beta-selective agonists. We have for beta-1, dobutamine, and for beta-2, salbutamol, albuterol, terbutaline, isoxaprine, ritodrine. Sinabi ko pa lang yung receptor, probably alam nyo na kung saan yung action. For the beta-1 selective, sympathomimetic drug. Dopamine, it acts on the heart. And for the beta-2, salbutamol, albu, terbu, isox, rito. Okay, you would probably think now that it's acting on the lungs. Alright, kasi nga beta-2. For the butamine, okay, it acts on beta-1. It decreases heart rate and contractility. It is used for patients with acute heart failure and patients undergoing cardiogenic shock. Since pag shock, again, nag-hypotensive yung patients. Side effects, because it increases heart rate, too much increase of the heart rate, it may cause tachycardia. It may even cause arrhythmia, so irregular yung rhythm. Tachyphylaxis, hypertension, kasi nga increase both heart rate and contractility, thereby increasing blood pressure. It may cause eosinophilic myocarditis, premature ventricular beats. These are abnormalities seen in your ECGs. Angina, dyspnea, fever, headache, and nausea. Okay? So your dobutamine, remember class na yung dobutamine, hindi siya dopamine. Okay? Magkaiba ang dobutamine sa dopamine. However, they are related because dobutamine is a synthetic catecholamine that is related to dopamine but whose activities are related to actions at alpha receptors and beta receptors with no effect on dopamine receptors. So, ang dobutamine, wala siyang effect sa dopamine receptors. Okay? And actually, it may have an effect on the alpha receptors but more on the beta receptors, specifically on the beta-1. This drug increases cardiac output with limited vasodilating activity and reflects tachycardia. So, via IV infusion nito class, it's parenterally administered. Usually, we give this in drips. And it has a short half-life of 2 minutes. Next, we go to the specific beta-2. Okay, the beta-2 selective agonist. Action is on the lungs. It causes bronchodilation. The main drug of choice for acute asthma is always salbutamol, but we can also use terbutaline also for asthma. But terbutaline, ritodrine, and isoxaprine more used for pregnant patients as tocolysis, especially in patients na nag-undergo ng preterm labor. Ibig sabihin, pampakapit. So we usually give them isoxaprine actually. Okay, it's the common drug to give for patients na nagpe-preterm labor. Side effects, tachycardia, okay? Why tachycardia? Kasi meron pa rin naman siyang effects. Alright? Meron pa rin naman siyang little effects sa beta-1, more effects lang on the beta-2. That's why meron pa rin siyang side effect. It may still have a side effect sa beta-1, which is tachycardia. It may even cause tremors, nervousness, restlessness, arrhythmias, and when used excessively, loss of responsiveness or pwedeng magkaroon ng tolerance. It may precipitate arrhythmias in patients with chronic obstructive pulmonary disease and heart disease. Your isoxaprine is used as a vasodilator also in Raynaud's phenomenon. So, if you have time, you can search on Raynaud's phenomenon. Usually, the symptom here is nagkakaroon ng discoloration sa may palm area. So, your Raynaud's disease or Raynaud's phenomenon, usually yung fingers and toes, nagnanumb sila and nagko-cold in response to stress or in cold temperatures. Because, ang nangyayari, kaya nagkakaroon ng numbness and coldness sa may hands and toes because the small arteries in those areas na nagsusupply dun sa skin mo, in those areas, they become narrow. So, limited ang blood flow, nagkakaroon ng vasospasm. So, you want to have dilation. Kaya, pwede ka magbigay ng isoxaprine as a vasodilator in these patients. Okay? What else to remember regarding salbutamol? Usually, may oral tayo na binibigay na salbutamol, pero meron din naman tayong yung mga for nebulization. Okay? Salbutamol nebule, which we usually give in patients with asthmatic attacks. Remember, bronchodilation, ang nangyari dyan, nirelax yung bronchial smooth muscle. Okay? They have long duration of action. For isoproterenol, remember, yung mention natin kanina, it activates the beta receptor with little activity on the alpha receptors, and it may also dilate the bronchial smooth muscle. Alright? So, that would be all for the beta 1 and beta 2 selective agonists. You just have to remember ano ba yung beta 1, syempre sa heart, and beta 2 sa lungs. Next, reuptake inhibitor and releasers. For the releasers, we have phenylpropanolamine. So, ang phenylpropanolamine, it acts mainly by causing the release of your norepinephrine, but also has direct agonist activity at some adrenergic receptors. It may activate alpha and beta adrenergic receptors in respiratory mucosa. So, yung kaya siya indirect acting because it acts through releasing norepinephrine, okay? But it may also act on the receptors. However, may special effect kasi siya na nag-i-increase siya ng release ng norepinephrine, okay? Na endogenous catecholamine ninyo na norepinephrine. So, it may be used as a nasal vasoconstrictor and an appetite suppressant. It may precipitate hemorrhagic stroke, especially in women. So, saan nyo ba nahanap yung mga phenylpropanolamine? If it sounds familiar, I'm sorry. So, it may also be used as a decongestant. Okay, it shrinks your blood vessels. Parang phenylephrine din siya. However, iba kasi yung mode of action niya. Kaya siya indirect na sympathomimetic. Okay. Pag may constriction ng blood vessels in your sinuses, ibig sabihin kasi nagde-decrease ka ng congestion. So, you want that to happen, you can give your phenylpropanolamine. Okay? It works by constricting. Okay, it's a vasoconstrictor. By constricting the blood vessels in your nose. Okay? And in your sinuses. So, again, yung phenylpropanolamine, it's different from phenylepinephrine. Lagi niyong tatandaan to, class, because maraming nalilito. For phenylephrine kasi, it's a direct, okay? It's a direct agonist. And for your phenylpropanolamine, which may also be found in your mga decongestants, okay? Diba, minsan meron kayo nakikitang phenylephrine, and then minsan may nakikita kayong phenylpropanolamine. Your Neozep kasi phenylephrine ang meron doon. Actually, meron din siyang chlorphenamine. Okay? So, ang meron sa Neozep niya is phenylephrine and not phenylpropanolamine. Okay? Your phenylephrine, it's the direct, and yung indirect, it's acting, it's the phenylpropanolamine. Lastly, yung mga amphetamine, okay, have your reuptake inhibitor. The example is amphetamine. So, for the sole purpose of learning, but we do not usually give amphetamine kasi unless we want narcolepsy or in patients with ADHD, it may also be a drug of choice. Okay, now your amphetamine, similar drug, your methamphetamine, it's a phenylisopropylamine. Okay, chemical structure niya is phenylisopropylamine. It displaces stored catecholamines from nerve endings. Alright, so it inhibits the reuptake of the endogenous substance for catecholamine. Now, it may be used as an anorexant for patients with ADHD. It may be a drug of choice, and in patients with narcolepsy or mga tulog ng tulog. It is given oral and parenteral. Okay, it has a duration of like more than 4 to 6 hours. That's why limited ang use niya, because it has a high addiction liability in patients taking this. May mga effects, behavioral changes, such as yung mga mabilis mapraning, paranoia, aggression, insomnia, and may even cause hypertension since it increases the level of catecholamine because it inhibits the reuptake. So, mas madami kang catecholamines na available. Okay? Okay, so, again, it's an indirect acting beta agonist, and it is a reuptake inhibitor. So, please remember that. So that would be all for your sympathomimetic drugs. I hope you learned something. Hopefully, at this time, in this pandemic, where you are at your homes, okay, sana babasa nyo yung Katsung. Please, class, make it na on a regular basis to read your Katsung book because maganda talaga siya. Okay, it explains the different drugs and mechanisms of action very well. Okay, you just have to understand. Okay, and allow yourselves na kapag unang basa nyo pa lang, when you didn't understand it, give yourselves a chance to understand it, to be able to understand it better. Okay, for the next readings, always give yourself the opportunity to learn. Okay, kung hindi nyo man siya na-gets nung una, you can always reread and you can always visit, okay, yung mga YouTube sites or yung mga videos para mas ma-enforce yung knowledge nyo or yung comprehension nyo dun sa nabasa ninyo. Okay? So, I hope that you have learned something regarding the sympathomimetics. I will also give voice recordings regarding the sympatholytics naman. Okay? Yung mga antagonist natin. Okay? Yung mga opposite actions. Drugs with opposite actions ng sympathetic. Alright? So, please review very well. You just have to read your Katsung. The tables that I sent you before, yung lahat na ng drugs andon. So, maganda rin yung part ng mga sa autonomic drugs. And of course, yung handout na binigay ko regarding sympathetic drugs, it's also a good handout. It was actually from BRS Pharmacology. Okay? We use that in medicine, but I believe parehas lang naman, no? So, you can also use it in pharma, for your pharmacology subjects. So, good luck, class, and God bless. And please continue reading. The more you use your brains, kasi, okay, the more na mas natitrain nyo siya or napapractice nyo siya. And then later on, when you take your board examinations, madali nilang para sa inyo as early as now para hindi na kayo mahirapan mag-aral masyado when the time comes na kayo na yung magbo-board exam. And I'm all rooting for you. And see you for the next, not see you, but please prepare for my next voice lectures.